Okay, and our meeting is being recorded. Hello and good afternoon, everyone. My name is Dr. Dominic Zerlo, and I'd like to welcome you to our second listening session for the Medical Psilocybin program. Thank you for being here. By registering and joining in this virtual setting, you are agreeing to be recorded and for the recording to be made public. If you do not agree, you may log off the meeting at this time. And again, I am Dr. Dominic Zerlo, and I am the Director for the New Mexico Department of Health Center for Medical Cannabis and Psilocybin. Joining me from the department today is Brenda Martinez, Deputy Director for the Center for Medical Cannabis and Psilocybin, Rosalie Nava, our Health Education Program Manager, Carmen Batista, Katie Freitag, and Adrian Estrada, our Health Education Team for the Center. Jonathan Mouche, Management Analyst, Raymond Gallegos, Systems and Data Analyst, and Kathy Augiri, our IT Project Manager. As an update for the program, as many of you probably know, Senate Bill 219, the Medical Psilocybin Act, was passed by the New Mexico State Legislature and signed into law by Governor Lujan Grisham this past spring. The statute took effect on June 20th, 2025, and it requires the Department of Health to stand up the program by December 31st, 2027. Currently, the program is working with both the Office of the Governor and the Office of the Secretary of Health to assemble the Medical Psilocybin Advisory Board. This process should result in the board being seated in September, as previously announced. Once it is seated, there will be several additional public meetings and listening sessions scheduled. Some of these will be conducted in person, and some will be virtual or hybrid. And by hybrid, we mean they will be in person with virtual options. The initial primary purpose of the board is to create, review, and recommend rules, regulations, and protocols for the structure and management of the program to the Secretary of Health. With this in mind, the specifics such as what licensure will be required, types of training and educational curriculum will be needed, requirements for cultivators, and protocols for treatment have not yet been determined. This and future listening sessions are one way the board members and the program hear thoughts, ideas, and concerns from the different community members who are or who may be involved in the program. As a reminder, this is being recorded, and the recordings will be made public on the program website. Please see the screen for the link to the program website as well as the program email. Please remember to refrain from using profanity or inappropriate language when speaking, as minors may watch this recording in the future, and inappropriate language or background may result in the recording not being able to be made available to the public. During the listening session, if you would like to speak, please raise your hand. If you are on a computer, please use the hand icon near the top of the Teams window. It says raise just under the hand icon. If on the Teams app on a phone, please press the ellipses, the three dots that are in the menu, and then the hand icon will appear and you can select it. If you are joining through voice only on a telephone, please press star 5 to raise or lower your hand. Once you have been selected, your name will be called and you will be able to unmute. To unmute or mute on Teams on a computer or on a Teams phone app, please click on the microphone icon. If you are joining by telephone on voice only, please press star 6 to unmute or mute. We will go through the list of people who wish to speak in the order people raise their hand. We will take comments from as many individuals as possible within the time allotted, which is until 4:30 p.m. Mountain Time today. Each individual will have up to 3 minutes to speak. When it is your turn to speak, your name will be announced as it appears in the meeting, and you will be able to unmute yourself at that time. If you are joining again on a computer or on the Teams phone app, simply click on the microphone icon to be able to unmute yourself. And if by telephone and voice only, please press *6 to unmute or mute yourself. When you start speaking, please state for the record your full name, and if you are here representing yourself, or if representing an organization or company, which organization or company you are representing. You may then make your statement. There will be a notification provided to help you complete your statement when 30 seconds remain in your time. At 3 minutes, your microphone will be muted. If at the end of the list of people who would like to speak, there is still time, anyone wishing to speak a second time will be provided with an opportunity to raise their hands again. And again, the listening session will end at 4:30, so we will stay on the line until 4:30 regardless of the number of people who are speaking. And if there are more individuals who would like to speak than time permits, we encourage you to join other listening sessions as they are scheduled. Future public meetings and listening sessions will be announced on the program website. In addition, we do now have a way to sign up for updates, and I will go through that in just a moment. However, if you also wish to provide a written statement, there will be options to do so at a later time after the board has been seated. Please remember this is a listening session, and the program will not be answering questions at this time. However, we will take the information and questions that may be posed during this session, and an FAQ will be published soon with information from this session and from the previous listening sessions. The recordings from this listening session and the previous listening session will be posted to the website once they have been reviewed to ensure there is no inappropriate language that is included on it. At this point in time, I will go through the steps for how to sign up for updates regarding the program. The first step would be to visit www.nmhealth.org. Once you do so, in the upper right-hand corner, there is a link where you can click to sign up for e-news. Once you click on that link, you will be taken to a page which requests your email address, first and last name, and your physical address. Complete those areas, and then the next step will be to complete or click on the link for Medical Psilocybin Program. Once you do that, at the bottom of the page, simply click Sign Up, and you may be asked to confirm if you are a robot, or not a robot, I should say. So please make sure to confirm you are not a robot. And at that point, you will be signed up for our e-updates. This information, the link to click and sign up for this, is also currently on our program website. So if you're familiar with our website, you can go there and join through this process. I will repeat this information towards the end of the presentation, or I'm sorry, towards the end of the session, and so that people have it and are able to go through that process. At this time, we are ready to start hearing from individuals. And so again, if you are on a computer and you would like to speak, please click on the raise your hand icon. If you are interested in speaking and you are on your phone on the Teams app, please click on the 3 ellipses in the menu, and then the hand icon will appear for you to select it. And if you are joining through voice only, please press *5.
Okay, we do have a number of folks. Again, we'll be calling on you in order of your raised hand. The first person is Andrew Constantine. Andrew, please go ahead and unmute your line. You have 3 minutes. If you're speaking, your line is still muted. Please press *6 or hit the microphone button. Okay, Andrew, we're not able to hear you, so I'm going to go ahead and mute your line. We'll come back to you. Next up is Jim Dodson. Jim, please unmute your line. You have 3 minutes.
I am Jim Dodson, a qualified candidate seeking the important role of patient advocate on the MPP Advisory Board. Treatment-resistant PTSD patients are forced to suffer, resulting in lost jobs, lost lives, and lost souls, leaving a legacy of despair for future generations to bear. Obviously, the Medical Psilocybin Act is the path forward for these desperate patients. At long last, a promising viable alternative treatment is coming. Speaking as an informed patient advocate, these vulnerable patients require easy, affordable, local access to like-minded facilitators and protection from any unauthorized misappropriation of this powerful sacred medicine. It is a gift of new life, too precious for profiteering. Speaking as a prospective facilitator, I want to be trained to help others like me in my small township. I'm not seeking a career. I'm a volunteer, supporting right to try act elderly patients, for example, on low incomes, seeking relief at the end of days. The Equity Fund must invest in improving the lives of our marginalized citizens. Once the success of this program bears good fruit, and it will, the return on investment will become a golden asset for our collective well-being. I'm not a healer. The medicine does all the heavy lifting. Maria Sabina is my source for ceremony and courage. As a servant to the patient, guiding and guarding over them during their journey. I recommend that all patients seek deeper ongoing integration by referring them to like-minded therapists, creating a dynamic circle of healing counterparts in collaboration. Imagine our state erasing trauma from every township, one facilitator at a time, harvesting a bountiful surplus of successful outcomes. Finally, easy, affordable access to medicine for all authorized patients. A patient develops a personal relationship with the medicine that saves them from themselves. Microdosing or occasional intentional use is a desired outcome for perpetuating wellness in these now knowledgeable patients. They are becoming fully capable of self-regulation by becoming whole,
You have
as
30
wellness
seconds
takes
remaining.
hold. And a healed patient has the potential to become an effective community resource, perhaps even as a facilitator. Imagine that. Thank you.
Thank you. Okay, Andrew, we're going to try your line again. Your mute has been, your microphone has been activated. Please unmute your line. You have 3 minutes.
Alrighty. Sorry about that. I was having issues with that. My name is Andrew Constantine, and I'm speaking as a student and as a part of the Blue Morpho Academy in Iquitos, Peru. I wanted to come on here to advocate for, how do I say this? The preservation and the integration of the traditional lineages that we're trying to integrate into our Western society. There's no standardization at the moment for any psychedelic spiritual practices, and this is something that the Blue Morpho Academy is trying to bring, and also into this new emerging culture that we're all kind of finding ourselves in. The main thing that I wanted to just say was, preserving and integrating the traditional lineages into this new way of how we're trying to work with medicine is something that I think is going to be really important for us to get the kind of results that we're really wanting. I think that's all I wanted to say. I'm just so glad to be here and listening to what everyone else has to say. So thank you so much.
Okay, next we will go to Dan Hussein. Dan, your line should be able to be unmuted. You have 3 minutes.
Hi there.
Hello.
Hello, my name is Daniel Hewson. I'm from the wonderful state of Oregon. I am the only licensed and approved psilocybin testing laboratory in the state of Oregon. There used to be 2 of us. I'm here to offer my insight into the industry and to help anybody with anything they need. I do not plan on opening up there in Colorado, but I want to help regulators. I want to help people understand what is broken here in Oregon and what is really the problem happening up here. Currently, it is not feasible for people to be doing treatments over time, and we have tons of data. Originally in the beginning went from higher doses, now they're more lower doses, and businesses are not sustainable. We're losing businesses all the time. Currently, year to date, I'm 9 months into this year of testing for the legal market, and I've only done $17,000 in total sales. In order to help the laboratory, whoever decides to open up in Nevada, I really encourage the regulators to allow them to test for anybody that is interested in having mushrooms tested, to allow them to be able to financially afford what is going on or what is happening in the industry. It is such a small industry. There's so many regulations, the costs and everything involved in it. Again, I just want to help. I put my phone number or my email address in the chat, Rose City Laboratories, Portland, Oregon. I'd love just to talk and tell everybody what's happening, what's good and what's not. I'm really excited to see you guys with these listening sessions and everything that's going on. And I just really am excited to see a 3rd state come online. Oregon is currently in the process of possibly closing up shop and stopping our psilocybin program because it's not sustainable with the fees, not sustainable with the requirements of only, not sustainable with the only requirements of only being able to test within the industry and so on and so forth. I just wish you guys all well. Congratulations. I'm available if you need me.
Thank you.
Thank you. Next, we will go to Kevin Lenaberg. Should apologize in advance if I mess up any names, so forgive me in advance. Kevin, your line is unmuted. You have 3 minutes.
You were very close. Lenaberg.
Lenaberg,
So
thank you.
You got it. So I'm Kevin Lenaberg. I'm the policy director for the patient advocacy nonprofit Clusterbusters and the executive director of the Psychedelics and Pain Association. 1 in 5 Americans suffers from a chronic pain disorder. And for the 4 conditions that are listed in the New Mexico Medical Psilocybin Act, all of them are associated with significantly higher rates of chronic pain. A growing body of research, both clinical trials and patient surveys, shows that people living with pain conditions, including cluster headache, migraine, fibromyalgia, low back pain, traumatic brain injuries, and more, find effective and enduring relief with the therapeutic use of psilocybin. The protocols of psilocybin for chronic pain are often different from those commonly used for mental health conditions, frequently involving lower dose amounts and multiple treatments. As you design the medical psilocybin program, we have a number of asks that we hope you will consider. Number 1, Ensure that all facilitators receive training in the use of psilocybin for chronic pain. Many of the people they treat will be suffering with pain in addition to other qualifying conditions. End-of-life care is one of the conditions mentioned in the legislation, and pain management is a core component of hospice care. Number 2, as quickly as possible, add chronic pain as one of the qualifying conditions to access psilocybin. The data supporting psilocybin for a wide range of chronic pain conditions is robust, and there is tremendous patient need for more effective therapies. Number 3, create flexible regulations allowing for the full range of therapeutic doses and frequencies of use that are best for a wide range of conditions. And last, number 4, explore responsible policies that will enable home use of psilocybin under the supervision of facilitators. Large doses of psilocybin with the mental health support of a present facilitator is just one of many methods of using psilocybin. Like how doctors can prescribe medicines for home use, facilitators should be able to authorize appropriate doses of psilocybin for qualified patients to use on their own. People with cluster headache most commonly use low doses of psilocybin, about 1 gram of dried mushroom, and they take it multiple times, each spread 5 days apart. And research shows that more than half of real-world use of psilocybin involves more frequent microdosing. Neither of these types of use work with the
30 seconds remaining.
facilitation-only model. People with pain are increasingly using and reporting remarkable healing with psilocybin. New Mexico has an incredible opportunity to reduce suffering and improve health by including chronic pain as a qualifying condition and allowing responsible, legal access to therapeutic home use of micro and low doses of psilocybin. Thank you for listening.
Thank you, Kevin.
Okay, next we go to Ann Hamilton. Ann, please unmute your line. You have 3 minutes. Ann, I see your line is still muted. If you're having difficulty, reminders to click the mic. There you go. Thank you.
Hear me? Amazing.
Yes.
Hi, everybody. Amazing.
Hi.
Thank you for hosting. My name is Ann Hamilton, and I'm the founder and executive director of the Survivorship Collective. We're the first nonprofit that designs and facilitates trauma-informed psilocybin group retreats for the oncology community and also end-of-life care. We've been working in Oregon, and we'll probably be working in Colorado soon. And I just wanted to say thank you for making this possibly available in New Mexico for our community. I know that this is already like a train that's moving, but one thing that we've been able to offer our community is group retreats, and it makes it more accessible. It makes it less expensive. And it's also something that is evolving in a very kind of organic way through community-led efforts. So as much as we are very grateful for and definitely need medical expertise where it comes to palliative care and oncology care, we also definitely need actual participants and actual patients saying what they need, because there's a lot of experts in the field, but not enough voices from the actual people who need it. And so I just wanted to say, if you ever need any help or guidance, we have an amazing group of people who are, metastatic patients, but also have a lot of life in them and time, who would love to talk about how to serve that community best, because there definitely needs to be more patient voices as well as expert voices. So thank you so much. That's all I have to say.
Thank you, Ann.
Okay, next we'll go to Trina Zoller. Trina, your line, please unmute your line. You have 3 minutes.
Can you hear me?
Yes, we can.
All right, thank you. My name is Trina Zahler. I'm a licensed clinical social worker, and I've worked in hospice and palliative care for the past 10 years. I have 4 suggestions that I'd like to make for the board today. The first is regarding the end-of-life care qualifying condition. I ask that we resist any temptation to define qualification based on a prognostic time frame, and instead we consider a broader palliative care definition that would include anyone with a life-limiting serious illness, regardless of hospice eligibility or specific prognosis. I've witnessed end-of-life anxiety keeping people from having conversations well upstream while they are still healthy enough to do so. And we often see that anxiety keep people from accepting hospice care until they're within the last few days of life. My hope is that by giving people this essential time and space, they can fully benefit from the treatment and be fully present to make these future treatment decisions as they move in their illness. My second suggestion is to consider inclusion of the daily support person in treatment. We witness up close how the anxiety of the support system informs and exacerbates anxiety in the patient. And by including the support person, my hope is that this would further support the person with serious illness and reduce the risk of complicated grief for the daily support person after death. My third suggestion is for the treatment protocol to include a protocol for microdosing. This could be based on established protocols that already exist, include periodic integration sessions, and especially in the realm of end-of-life care, thinking of ways on how to reduce the anxiety about the treatment itself and familiarize people with the experience of letting go. That control, I think, could be very helpful. And then my fourth suggestion is regarding clinician training. For this, I'm hoping that the board will create a licensure process similar to what we see for social work, one in which a variety of training programs across the country are accepted as an initial basis for being a clinician. Second, perhaps including a threshold requirement for hours, among those programs.
You have 30 seconds remaining.
And most importantly, including a New Mexico specific class on the rules and ethics and cultural considerations of psilocybin assisted treatment here in this state. And with that, be able to provide a source of licensure for people to practice this. Thank you so much.
Thank you, Trina.
Next we go to Paul Walton. Paul, please unmute your line. You have 3 minutes.
Hi, can you hear me?
We can.
My name is Paul Walton, and I want to thank you first for the opportunity to speak. And this is a great opportunity for New Mexico to lead in policy that is safe and that is reachable for all those in need. I'm with Firefighters for Plant Medicine, and I've been a firefighter in New Mexico for over 17 years. As a firefighter, I've witnessed and experienced firsthand the physical and emotional toll that roles can impose on individuals. Our work often involves exposure to traumatic events that can lead to several work-related injuries, PTSD being just one of them, also pain, sleeping disorder, anxiety, to name a few others. Yet first responders are often overlooked when it comes to mental health treatment. To clarify, first responders are not just firefighters, law enforcement, or EMS, but also corrections, dispatch, and emergency room staff as well. These work-related PTSD symptoms often make normal, everyday life a struggle for first responders. These struggles not only affect first responders, but their families and everyone around them. Unfortunately, first responders are often the last to seek help due to cultural stigmas surrounding mental health. Ask a first responder how they feel. Even on their worst day, they will tell you they are fine. This, along with affordability, presents treatment barriers for first responders. How do we make it affordable for first responders? A couple ideas, and maybe having a New Mexico state equity fund that would relieve some of the cost for treatments, or possibly some kind of reward system for those that are willing to treat first responders in a reduced rate. And how do we solve the stigma? As first responders cannot show emotion, they must carry that trauma with them without looking weak and be in control of the situation. So these are barriers. And in order to treat these public servants, we must first reach them and break down these treatment barriers. First responders are not your normal health patient and need special attention for effective treatment. This could be achieved with special treatment protocols for therapists treating first responders. I've talked with numerous first responders, and a lot would not be comfortable in a clinical or group setting for an experience. So I feel like making the settings and accommodating patients with special needs and comfort levels would be a great benefit when deciding on these regulations. Another tool to address treatment barriers would be microdosing. As mentioned before, having a microdose treatment regulation could help those that are uncomfortable going right into
30
a
seconds
macro,
remaining.
going right into a macro or therapeutic dose. This would help the first responder patient open up and soften those emotional and control barriers they have built up for years. I would love to help advise the Department of Health in any policy or regulation rules related to first responders. And I hope that the New Mexico Department of Health will look at these barriers for first responders seriously and find a way to work with advisors and to find solutions to help our public servants. When our first responders are healthier, their families, coworkers, employers benefit, and the communities directly
Your
benefit
time's
from
up.
safer health.
Thank you.
Thank you, Paul.
Thanks.
Okay, next we go to Joshua Capel. Remember that apology I gave earlier. Joshua, please unmute your line.
Hi, thank you. It's Joshua Capel, and thank you very much. Um, and I just want to give a thanks to the New Mexico Health Department for having this listening session. It's really important, to obtain public feedback, to develop a really inclusive and safe program. My name is Joshua Capel. I'm an attorney licensed in Colorado. I was one of the main drafters for the Colorado Natural Medicine Health Act. I chaired the campaign committee, and I currently serve as the senior policy director for the Healing Advocacy Fund, in addition to representing private clients through my law firm at Vicente. New Mexico is now the third state to create access to psychedelic care. Similar to how Colorado had the opportunity to build off of Oregon, New Mexico has the opportunity to build off of both Colorado and Oregon and truly create a model program for future states. In Colorado, we've been focusing on affordability, inclusivity, and safety. We've made large steps forward, but yet more could still be done to ensure that every adult who needs medical access to psilocybin care receives it at a price point they can afford and in a setting they feel safe and comfortable. This is where the opportunity lies in New Mexico. Ultimately, if we're looking to increase affordability, we need smart regulations that protect public from harm and are not overly burdensome that increase the cost of services. A couple of thoughts around affordability. One, group sessions. It goes without saying that group sessions, will help on affordability. Number two, separate rules of care. Having different licensed professionals and different rules of care could help lower costs, by having more expensive medical professionals at the screening phase and less expensive facilitators or traditional healers in the facilitation phase. And hopefully, having an inclusive definition of a clinician to include those who've been practicing with these medicines, working with a medical provider, would be also helpful in lowering the cost of care and increasing inclusivity. Another sort of piece is expanding the definition of a clinician to include healthcare providers that are also entities in addition to healthcare providers that are individuals. This could also, allow for a broader range of members on a team to provide care and address, an issue that's come up with DEA registrations. Another potential way to reduce care is having flexible locations, is trusting the medical providers and the care teams to provide psilocybin care in places that they feel are safe and comfortable
You have
and
30
not
seconds
requiring
remaining.
overly burdened regulations. And finally, and I'll talk more if there's more time later, but I do want to say one of the biggest things we miss in Colorado is excluding pain patients and those who take low-dose psychedelics instead of SSRIs or who microdose. And in New Mexico, there is opportunity to expand the definition of medical services to include these modalities of care that don't involve direct physical supervision, but more of an oversight model. And this would
Your time
really
is up.
greatly increase the inclusivity of this program. Thank you very much.
Thank you, Joshua.
Okay, next we go to Amy. Amy has no last name displayed. Amy, please unmute your line. As a reminder, you can press the mic icon or press *6 on your phone. Amy, please unmute your line. Okay, Amy may be having some difficulty unmuting. We'll come back to her. Next is Wendy Jean Linscott. Wendy, please unmute your line.
Can you hear me?
We can. You have 3 minutes.
Excellent. Thank you so much, Kathy and Dominic. We are grateful for this opportunity. Nice to see you again, Dominic, circling back around a few years later after we got the micro licenses out from my previous proposal. I'm here as a CEO of a nanotechnology company that is working on a product for the state, and it is in alignment with the psilocybin program. We have a network clinicians outside working with us on this. What we have, Kathy and Dominic and the people listening, are a mycelium that has miracle molecules, a C60 fullerene miracle molecule in it that is a radical scavenger of AIDS, HIV, cancer, and all this in our medicine. And so that it also has mycocannabinoids. So our focus has been on the molecular medicine because our body and our cells only need what we need, and there's so many contaminants that can be taken up in these mushrooms that are grown and given out to people that we're not able to test on. So you may be pulling up uranium and you don't know that that's what your mushroom is getting. So we've really been focusing on the molecular and the healing parts and molecules in the mushroom and fungi world. And we're excited about the lab that we have created for a pilot study, and we look forward to advancing our conversations on this because it includes the public. And by donating our medicines that we're creating, we are now opening a whole new world of research on quantum medicine with this C60 miracle molecule in our mycelium. It's also able to be transferred into our mushroom genetics. So we're the first to have it here in New Mexico. So we're really excited about that and advancing our mushroom medicine molecular technology. And with that, everything that we've created from this, the waste is not waste because now we are able to transfer that
30 seconds
with the
remaining.
state on a monetary. Thank you. On a monetary level, by our waste products being turned into quantum dot nanotechnology that we get to work with the state on for interstate commerce revenue and free treatments for the people by a fully supported private funded program. So I look forward to meeting with you on this and future discussions with you, Dominic, Kathy, and the state. This is for everybody, and it's treatment, and treatment should be free. So we helped facilitate this, and it's a whole community coming together for this to happen. Thank you.
Thank
Thank you, Wendy.
Okay, I see Amy has rejoined. So Amy, I'm going to come back to you. Please unmute your line.
Can you hear me?
Yes, I can.
Great. So thank you for the opportunity to speak today. My name is Amy Trumper, and I'm currently a graduate counseling student. I'm not speaking on behalf of an organization, just as a passionate community member. First, I want to acknowledge how hopeful I feel about the passage of SB 219. This legislation is a landmark for New Mexico, and I'm grateful for the Department of Health's leadership in guiding its implementation. One of the strongest parts of the bill is the requirement that psilocybin must be cultivated here in New Mexico. That decision ensures that the benefits, both economic and cultural, stay rooted in our state. I believe the same principles should apply to facilitator training. Training is not just a technical process, it shapes the values, ethics, and culture of this entire program. If we allow out-of-state organizations to come in and set up shop, we risk outsourcing our framework to entities that may not share New Mexico's priorities or cultural context. We have the talent, the knowledge, and the community here to build training programs that are accountable to New Mexicans, programs that honor our unique diversity, reflect our local values, and integrate the voices of Nation, tribe, and Pueblo peoples, not just as an afterthought, but as co-designers. I recently attended a Colorado-based training orientation, and when asked about New Mexico, their response was, "Oh yeah, we'll definitely be offering training there." That gave me pause. I don't doubt their expertise, but New Mexico deserves training programs that are built for and by New Mexicans, just as cultivation is required to be. If cultivation must remain local, why shouldn't facilitation training? Both are foundational, both set the tone for what this program will become, and both should remain accountable to the communities who will be most impacted. I believe New Mexico can build something not just effective, but deeply rooted and truly our own. Thank you for listening and for your leadership.
Thank you, Amy.
Okay, next we go to James Brown. James, your mic should be ready. Please unmute your line.
Afternoon, everyone. My name is Dr. James Brown, and I am a registered pharmacist here in New Mexico, as well as a disabled foreign war veteran. I served in the Navy for 8 years for this great country and this state. This is an amazing time, and to echo Amy, that is something that needs to be driven by New Mexicans, for New Mexicans, and in a way that if we had heard this, I am trained in Oregon as a facilitator. And as a facilitator of psilocybin in Oregon, it's very difficult. It's very costly. Access is not there, only for the very elite groups of people. And as you know, New Mexico is not that way. We need access for every New Mexican. And so I'm here today to advocate for that access. We need to propose that every business license that is given out has an equity plan attached to it. Equity is very important to New Mexico. This should be a requirement and a necessity to require to be a license in New Mexico. Individuals as well as groups. So this should be a group and individual setting. Set and setting is very important, as you know, as well as preparation, integration is key. It's the responsibility of the Department of Health as well as the psilocybin board to steward and ensure that New Mexico medical psilocybin program is sustainable. And it must be in our mindsets and thinking of looking at the long-term benefits. And what are the other consequences? You know, as a pharmacist, I want to make sure that everybody is aware that there is consequences to things that can happen with this powerful medicine, and there's side effects. And I'm here to advocate for that. And I'd love to partner with the Department of Health as well as the psilocybin board to be that advocate for those type of interactions, adverse effects, drug disease state. These things need to be in guidelines, need to be written, as well as telepharmacy. This is a thing that is huge to New Mexico. We have an opportunity to use telepharmacy to increase our access in our homes. This should be used in homes, clinics, outside, inside. Again, a telepharmacy model. The regulations need to have dose, what type, frequency. And I want to also propose today a prescription model. This model would be based off of other based medical current guidelines, policies,
30
procedures
seconds
that are
remaining.
already in place. A prescription-based model will allow us to use and protect New Mexicans. As you're aware, this would also be a help with DRG billing, coding. As you well know, Medicare, Medicaid are the primary payer for this state. And so we need to find access that way. And so create a DRG code using prescription-based models. Again, thank you for your time and everybody's space today. I do appreciate you.
Thank you, James.
Okay, next we go to Stuart Anderson. Please unmute your line.
Can you hear me?
Yes, I can.
Great. Well, thank you so much for doing this, and there are definitely people much more versed in psilocybin than myself that are on this call, because I know some of them. I am a primary care doctor and also a ketamine provider here in Santa Fe. And so I just wanted to say, I think that the way that so there are things that are advantageous about, or that we can look to as the way that we provide ketamine for patients for chronic pain, substance abuse, depression, PTSD, and for end of life angst or end of life anxiety, excuse me. Which and so opening up using psilocybin for all of those, I think could be really fantastic. Some of the challenges with ketamine therapy are, one, it's not covered by any insurance, Medicare, Medicaid, and cost can become quite an issue. So we look to doing group sessions. Psilocybin is, of course, a more challenging um, treatment because it's substantially longer, 4 to 6 hours versus 1 to 2. And so being able to have prescribers, be responsible for deciding who is going to actually who is okay to receive the medicine, and then training other other folks to sit with patients either in the home as uh, forgive me, I can't remember who the person was talking. It's like in hospice, hospice nurses being able to sit with people or doing group sessions um, as a way of distributing the cost and making it financially feasible for businesses here in New Mexico to provide that care. And I do think, there's that question, as Dr. Brown was alluding to, of doing telemedicine. There is this, with ketamine, during COVID, things sort of exploded with Mind Bloom and Joyful, or whatever, all these other um, outside companies just doing telemedicine sessions and prescribing relatively large doses of ketamine with very little oversight. And on the one hand, we have a very remote state and we want to make that access available, but
You have
it
30
really
seconds
hasn't
remaining.
been regulated much. And so I think doing that in a better fashion would be beneficial for our patients here in the state. So thank you for your time. And I'm so excited that New Mexico is making this move. Thank you.
Thank you, Stuart.
Okay, next we go to Lisa. Lisa, there's no last name listed for you, so hopefully there's not more than one with their hand up at the moment. Lisa, please unmute your line.
Hello, can you guys hear me?
Yes, we can. Thank you.
Perfect. Hi, thank you so much for hosting this. My name is Lisa Ginsberg. I'm the founder of Changa Institute. We are a state-regulated training program based in Oregon and Colorado. I would like to advocate for a layer of protection and dual licensure for facilitators, similar to Colorado model, to protect medical license providers due to the federal status of psilocybin, which is federally illegal and prohibited. Licensed medical providers, especially those who can write prescriptions, potentially can face danger of losing their license by engaging with federally legal substance. So I would like to urge the state pay attention to that and create a layer of protection to make sure that nurses and all other medical practitioners will be protected and incentivized to engage in this practice. Also, I would like to advocate for open access to education. I think there's so many brilliant researchers and clinicians and people that have hands-on experience from Oregon and Colorado and actively working with facilitating the sessions can add a tremendous amount of knowledge and experience to future practitioners. And I think it would be a big missed opportunity restricting access to education and knowledge by not allowing outside educators to enter the market. That would be all. Thank you.
Thank you, Lisa.
Okay, next we go to Chad Lozano. Chad, please unmute your line.
So can y'all hear me?
We can.
Okay. Hello, everyone. Dr. Zerla, hello. Good hearing from you. Good seeing you. A lot of people in here today. I'm just really jumping on today to show support and really hope that we can steer this medical psilocybin the right direction. If some of you don't know me, I've been a long time medical cannabis and cannabis advocate here in New Mexico for many years, over a decade, especially when we were with the medical cannabis side of the DOH. And also supported this psilocybin stuff, you know, when it was going down the legislature too. So I really hope that we can get something for New Mexico and learn the lessons from Oregon and Colorado what not to do. That's something huge to remember because, as been said many times already, that it's really expensive in a lot of these states to either operate or just to be a patient there. And we have to keep in mind that New Mexico is plagued by, I wouldn't say plagued, but we are a very depressed state. Even in the medical cannabis years, you know, a lot of the patients had a hard time affording cannabis, and still to this day. And that's not going to change with the psilocybin side. So we have to ensure that even New Mexicans can get.
Chad, it appears we may have lost you.
You guys hear me?
There you go. We can hear you
Sorry,
again.
I was coming from the CCD hearing, so I'm heading back to Cruces, so I'm on the road. Sorry about that. How much time do I have left?
1 minute, 30 seconds.
Cool. Awesome. Thank you. I don't know where it stopped off, but I want to make sure that, you know, New Mexicans get affordable medical psilocybin. Let's learn from the mistakes that Oregon and Colorado has made. Let's not do everything that those states do, but also keep in mind that we're going to make our own mistakes and we have to do things the New Mexican way. There's not one right way to do this, and it's the way that's going to work for us. So I want to make sure that, you know, the patients are taken care of, and also the fact that New Mexicans can get involved in this. And it's not just the most elite New Mexicans with the most money. I believe that, you know, some of the best medicines come from the people who can't always afford the most expensive licenses. So if we keep those things in mind, I think this program will thrive and we can be a model for the rest of the nation. But let's just keep those things in mind, and also learn from the mistakes that we have from the other markets, like in the medical cannabis program, how it was so limited and so expensive. So thank you so much, and I'm excited to see where this goes. Thank you, guys.
Thank you, Chad.
Thank you.
Okay, next we go to Jen Clemente. Jen, please unmute your line.
Hi, thanks so much for having me on. My name's Jen. I live in Truth or Consequences. I volunteer for End of Life Options New Mexico, and I'm also the psychedelic education lead at our hopefully future service center here in our little town. I really advocate for the rigorous spirit medicine preparation and integration, and I'm really excited about the emerging fields of psychedelic chaplaincy and death doula work. So, given the breadth of training most people in this field have already attained and the financial constraints that most doulas and chaplains face, I suggest that the state allow chaplains and death doulas to complete whichever facilitator training program they find most suitable, so as long as they also pass a single standardized state exam. That way, everyone is held to the same standard of safety and ethics while still honoring the diversity of training paths. To support this, I encourage the development of a study guide for that exam. It should cover all the basics like psilocybin pharmacology, trauma-informed and culturally competent care, end-of-life applications, crisis response, ethics and boundaries, and the specific laws here in New Mexico. The balance of flexibility and accountability would help ensure safety while also letting hospice chaplains and doulas bring their unique gifts into this important work without enduring more financial strain.
Thank you, Jen.
Thank you.
Okay, next we go to Mason Burks. My apologies. Mason, please unmute your line.
Hi, can you hear me?
Yes, we can.
Awesome. 1 second. All right. So hi, my name is Mason Burks, and I'm here as the operations coordinator of ABQ PSI, which is an Albuquerque-based harm reduction drug education nonprofit. I've taken psilocybin a couple of hundred times and have been a passive attending support person for about as many people. And it's from that perspective that I want to emphasize two main points. The first is not only is there an immense possibility for the perpetuation of inequality due to the differential access and predatory insurance industry and licensing restrictions and all that sort of thing, but the efficacy of therapy as a whole is dependent on the way in which someone aligns with the Western conception of like what individuality is, like the atomized, isolated, wrong assumptions that are made about like what a person is, which is to say the degree to which an individual conforms to colonial and late capitalist conceptions of human life that are at odds with the relational communal ways that are rooted deeply in our biology and our cultural systems, and then the way that these medicines work, which is to say white people for the most part. So I advise in the strongest terms possible the development of a framework which can permit the use, likely in lower doses than the breakthrough catalyst doses used in the literature, of psilocybin in community settings where immersion in familial and cultural fabric can permit the healing damage that exists in that same collective reality. Timothy O'Leary was wrong about a whole lot of things, but the limitations of the clinical model are not one of them. Number two, this program has increased psilocybin use. It's not going to, has. I know this for a fact. The governmental approval of these medicines, even in the abstract, dissolves the only barrier remaining for a great many people who are already pursuing access and who may, in the end, remain excluded from the designated qualification for whatever this program turns into. And I'm not referring only to underground practitioners that have had training, but to people who have no training whatsoever. And for this reason, I advise again in the strongest possible terms that the program make available a consumer-oriented body of literature that may permit those pursuing healing outside of the bounds of officially sanctioned spaces to nonetheless ensure that these experiences can remain in line with the contemporary understanding of what components of clinical therapy can or should be carried over into an informal or personal kind of context, and just as importantly, to review in clear language what manner of dosing, involvement, guiding, directing, etc., is sensitive to a degree that it really should remain in the purview of highly trained facilitators. Again, this isn't enabling illicit use or going outside of the law. This is harm reduction. Thank you.
Thank you, Mason.
Okay, next we go to Amy Wong Hope. Amy, please unmute your line.
Hi, so thank you again for this opportunity for the second listening session. So I wanted to underscore what I believe it was Dan Hewson said from Oregon. Far and wide from talking to lots of folks up in Oregon, which is where I did my training, they say that the way the program has been administered and the rules and regulations there has really reduce the amount of facilitators who are seeking relicensure, and also facilitation centers are they're really not financially viable, and also for journeyers they can't afford to have multiple journeys when they might need them for really for depression and PTSD and substance use. So what many are saying up in Oregon is that the way that the current market up there has been implemented in the rules and regulations has really driven all use underground at this point. So this is something very important for us in New Mexico to consider, that we want to make sure that we find a way to make sure our rules and regulations are about safety. I really loved what Jen Clement said about possibly having a study guide and a low-cost option for people to get licensure. My other point I wanted to make was to say that it looks like 3 or 4 designated psilocybin advisory board members in certain areas and certain affinity groups. And I hope that the DOH will consider having possibly someone who's knowledgeable about predatory business practices on your board to protect the operators in New Mexico from predatory business practices. Having someone who might be also a cultivator and someone who understands the business of cultivation and what's gone wrong in other states where we know in the cannabis world it really outpriced the local cultivators for cannabis, and that became problematic in many different states. And so we really want our local cultivators to be championed here, because they're really growing medicine for the people that live here, and there's like that deep connection. So that's pretty much all I wanted to say. Thank you so much for this time.
Thank you, Amy.
Okay, next we go to Cassandra Godelay. Cassandra, please unmute your line. You have 3 minutes. Okay, I see your line is still muted, Cassandra. Press the mic icon to unmute or press *6 from your phone. Okay, Cassandra, we'll come back to you. Next, we'll go to Mitchell Dingell. Mitchell, please unmute your line.
Hello, my name is Mitch Dingle, and I was present for the first listening session last month on August 26th. I have been heavily involved with the medical cannabis industry in New Mexico since 2017, and it has been a great joy and honor to have been a part of that program. I have worked for several legacy producers, so I implore the Department of Health to please be mindful of the amount of cultivation licenses issued. I would like to advocate for a strict cap on these cultivation or production licenses. 1 gram of dried psilocybin is very, very different from 1 gram of cannabis flower. I want to emphasize that again. There is no need to flood New Mexico with an overabundance of psilocybin. We need to emphasize compliance and adherence to strict guidelines so that this medicine stays true to the goals and ethics for this patient-centric program. I am so excited that the Department of Health will be overseeing this, as the medical cannabis program was extremely successful, and I am optimistic that this will follow in the footsteps of that. That is all. Thank you very much for your time today.
Thank you, Mitch. Kathy, can we go back and see if Cassandra is able to unmute?
Yes, Cassandra, your line is open. Please unmute your line.
Cassandra, we do need you to unmute your line if you would like to speak. Okay, Cassandra, we will come back to you. If you would like to speak, please go ahead and raise your hand again. Dan, just because, Dan Husan, just because we want to ensure other people who have not yet spoken yet have the opportunity, we will come back to you. But first, I'd like to open it up and make sure that anyone who has not yet spoken has the opportunity. So if you are interested in speaking, please go ahead and raise your hand here in the Teams program. If you are on a computer or if you are on a computer, please click on the hand icon near the top of the Teams window, and it says raise under that icon. If you're on the Teams app on a phone, if you please press on the ellipses, which are the 3 dots that are in the menu, then the hand icon will appear and you can click on it to raise your hand. If you are joining through voice only on a phone, please press *5 to raise or lower your hand. And we'll give folks a minute or so to be able to do that, just to ensure that everyone who wishes to speak has the opportunity. After that, we will go to anyone who wishes to speak a second time. Okay, we do have Cassandra has, oh,
Raised
I'm
her
sorry.
hand again.
Yes, has raised hand again.
Cassandra, please unmute your line. You have 3 minutes.
Okay, Cassandra, we cannot hear you. We do need you to unmute your line. If you are on a computer or on the Teams app on the phone, you just need to click on the microphone icon. If you are on telephone, voice only, please press *6 to unmute. Okay, Cassandra, we will come back to you just to make sure, see if we can get over the technical issue. In the meantime, seeing that there's no one else who hasn't spoken yet in the queue, we will go ahead and move forward to Dan Hewson. Kathy, if you will unmute Dan.
Dan, please unmute your line. You have 3 minutes.
Hello, thank you again for being able to speak a second time from up here in Oregon. I wanted to let everybody know that I heard something earlier. Somebody said that once you guys start talking about regulations, this or that, it kind of opens it up and people start consuming or thinking it's probably going to be okay and start down that road. So I just want to inform everybody that here in Oregon, there is a massive issue with black market or unregulated psilocybin, quote unquote, psilocybin products on the market. Rose City Laboratories, Oregon State University, and Shimatsu, big manufacturer of equipment, have a white paper being published in the JAMA Network, Journal of American Medicine Association, and it talks about the black market psychedelics and what is actually in them. As a laboratory on the black market, you can go into any pipe shop or smoke shop or and even convenience stores and pick these items up. Inside of these items are things like horse tranquilizers. We found Adderall. We found DMT. We found all kinds of products in this. It's actually going to be a big topic hitting the news and media here in Oregon. I can share the publication with anybody after September 11th. Again, be very, very cautious about the black market and please try to do something about it.
Thank you, Dan.
Okay, Cassandra, we're going to come back to you. Please unmute your line. Cassandra, your line is still muted. I'm not sure if you tried dropping and rejoining, but sometimes people find some success with that when they're having difficulty. So I may suggest that for you. But we're going to go ahead and call on the next person. And that person is Wendy Jane Linscott. Wendy, please unmute your line.
Hear me?
Yes.
Excellent. Thank you so much, Kathy and Dominic. Cassandra Guderle is sitting next to me. She's having technical difficulty with her speaker, even though she keeps hitting the mic button. For some reason, it's not letting her speak. So what I wanted to do, thank you so much, was speak a little bit more about some of the concerns that people are addressing. The big thing about having local facilitators and local people working from New Mexico, the people of New Mexico, you have local healers, medical practitioners, curanderas that are facilitators, people who have experience with psilocybin, mushroom, and psychedelic medicines, and facilitating that in a safe and ethical environment. in hopefully a managed care setting. And that's what we're focusing on for the people here, because the people who do live here, who are in this and interested in this, already know who the black market dealers are. And I'm going to just tell you, I mean, I'm not going to mention names, but I already know who they are, which is one of the reasons why it has catapulted me into the molecular medicine to understand and produce through my company, Angels of Alchemy, in this lab, biodynamic, safe psilocybin and psilocin and other molecules from the mushroom medicine. And it's fully funded and free for the state and the participants. So we have the full package that we have the ability to incorporate and include the people and the patients of New Mexico. So it's an integrated system where the people created the medicine, the people produce the medicine, the people test the medicine, the people are the facilitators. So we're not going to try and poison each other. So we're the ones that are creating it. And what it's going to do is it's going to tick off the black market, because what we're doing is we're creating a medicine that's going to be free for the people, so the black market can't make money off of it. There goes the black market. So you're going to know who the black market people are, because you're going to have the people who are serious about their healing involved in the free psilocybin program that's able to fund itself with all the different disciplines and all the different practices, cultural, from death doula to pregnancy and bipolar and Alzheimer's and even AIDS treatment, with what we have in our molecular medicine.
You have
with the
30
miracle
seconds remaining.
molecules. So, thank you, Kathy. So that's why I wanted to speak again and just say we've looked at all of this. James Brown is a part of it, is a PharmD. The lab that we're working with is a state lab. So we're looking forward to what we're bringing and including the communities of people who are seeking this and the treatments for their greater good and the greater good of the community. So thank you all so much for this opportunity. And here we go.
Thank you, Wendy.
Okay, I see that Cassandra's raised her hand again. Cassandra, please try and unmute your line.
Yay!
Yay! There you go.
Thank you guys so much. So I'm Cassandra Corolea. I worked really hard on the, will you mute yours? On the cannabis program, as far as monitoring it and just checking it out. There is an echo, just give me 1 second. I'm really working really hard to get that approved. So I don't know why there's an echo. But I was really active on the cannabis side, and I kind of don't want that to happen for the mushroom side. I really want it to be more ethical. I don't want it to be like,
Oh, I see Wendy's line is muted. Sorry, Cassandra, your line is muted.
can you hear me now?
Yes.
Okay, so I just hope that the integrity of this mushroom psilocybin program stays intact. I would hope that it's more like a therapy-based, clinical-based, not necessarily saying it has to stay in, hospitals or anything like that, but I hope that there is clinician care, there is, curanderas, there is people around in a therapeutic setting really having these doses in a safety dose setting, like the MD in here said, it could get really, and I'm just going to straight up and say it could get really dangerous per the doses, per access. And so clean medicine is really important. Access is really important. Dosing is really important, and keeping it ethical, keeping it as a practitioner basis, and not something where there's a mushroom clinic on every corner of New Mexico. I think that would be very dangerous to the people of New Mexico, as well as very unmanageable. So I really hope that when we're thinking about this program, we're putting the patients first rather than profits. This is not something to where people are going to make millions of dollars, but I hope that it would help the
You have 30
medical
seconds remaining.
standpoint and the mental rehabilitation of the state. And that's the most important thing. And if we are overdosing, if we are over prescribing, that is going to do the complete opposite of what this program is trying to do. So I hope and pray that everybody takes doses into consideration and mental health into consideration, because that's mainly what this program is for. Thank you.
Thank you, Cassandra. And thank you for bearing with us to be able to get you to be able to speak.
Thank you so much, guys.
Okay, next we go back to Joshua. Joshua, please unmute your line.
Thank you. And thank you very much for the opportunity to speak again. Just to build off of, some earlier comments around, the black market or the private market. I do think like one of the big reasons to create an inclusive program is to provide people an opportunity to participate in the regulated sphere. And by creating a system that brings in traditional or legacy healers and provides them a way to participate, actually gives them a path to be licensed and to be in this system. Otherwise, they'll continue to do what they've been doing for 20 years, and they probably have done a lot of good work in those 20 years. Likewise, creating a system that allows for low dose psychedelics at home for pain or microdosing, through sort of like the definition of medical services, also creates a more inclusive program. And by giving people access and pathways, to do things legally, it's not going to eliminate, but it will help to minimize, the dangers of the private market. A couple other pieces I just wanted to say around, things to think about, around affordability. One is, just like an encouragement to try and figure out how do we allow for Medicaid coding for preparation or integration sessions or follow-on integration sessions. And is there any way to get state Medicaid dollars in there? And I think that's something that's really worth exploring. As it relates to safety, I think the biggest safety piece is the actual provider of the medicine. It's the safety screens, it's the clinician, the facilitator, and making sure that training is adequately tailored to them. Making sure that they have appropriate training that allows them to really address all the potential harms and all the potential situations as they provide this care. Also making sure that that training is uniquely tailored. It's not helpful for people to engage in duplicative training. It's actually kind of a burden for people to participate in this program. And so having uniquely tailored training for specific professionals, would go a long way. In safety. And then the final piece on safety, just making sure that we have good outcome reporting. This is a very new, from a regulated standpoint, this is a very new modality of care, and we don't know what sort of contraindications might be happening. We just don't know a lot. We do know a lot, but we also don't know a lot. And so just, good outcome reporting around adverse events, good outcome reporting around the benefits and the efficacy of these programs, I think will go a long way in allowing us to adjust the program to increase safety and increase efficacy. So, thank you all very much for your time.
Thank you, Josh. And just because we do have at least one individual on the list who has not yet spoken, and we do want to hear from as many people as possible, we're going to go a little bit out of order for a moment and go to Brandon Johnson. Brandon, Kathy will unmute you in a moment. Actually, you are unmuted. You can unmute your line at this time, Brandon.
Hello, my name is Brandon Johnson. I just wanted to jump on here and say thank you, first of all. It's really beautiful to hear this conversation and be a part of this. One of the first people that spoke talked about somebody working with this medicine and coming full circle to be able to be a supporter for the community. And I just wanted to say, as an advocate for the medicine, over a year and a half ago, I was an alcoholic and in a really, really difficult place in my life. And this medicine, having to go out of country and then coming back and working underground, I was able to get past that addiction a year and a half ago, and now I can be a really strong support for the community. So I'm really excited that this is going to become more accessible for the people of New Mexico. And yeah, it's just an incredible opportunity for individual healing and community healing. So thank you so much.
Thank you, Brandon. And again, just so that we are able to hear from everyone at least once who wanted to speak, we will jump to Dr. Samuel Nez. Dr. Nez, if you will unmute your line, you are ready to speak.
Hi there, thank you. Can you hear me?
Yes, we can.
Perfect. So my name is Dr. Samuel Nez. I'm actually a practitioner of curanderismo. So as New Mexico implements this Medical Psilocybin Act and the program, I think it's important to remember that New Mexico has recognized traditional healers through the Unlicensed Healthcare Practice Act. So there's curanderos, there's curanderas, medicine people, and traditional healers that carry generational knowledge that are trusted by the communities. In Colorado, I've already seen the difficulties with the accessibility when it comes to the traditional healers that weren't included. These communities have deep ties to the sacred medicines, and they're often the ones that are left out or pushed to the margins. So in enacting this program, I think it's important to have a legacy pathway that recognizes traditional healers. Otherwise, all we're doing is creating a system that privileges only Western clinical providers and sidelining the very people in which this medicine was safeguarded. Thank you.
Thank you, Samuel.
Okay, next we'll go to Mason Burks. Mason, please unmute your line.
Hi, can you hear me?
Yes, we can.
Awesome. Thank you again for the opportunity to speak a second time. I briefly wanted to address a couple of things that have been said previously by the attendees, but I promise I'm circling back to comment directed at y'all. I just wanted to point out that you know, the conflation of the black market with like what you might call unethical actors, people who are only concerned with profit, is an artifact of some you know, discourse around the drug war that is predicated on false assumptions. And in our discussion around, you know, and this is not at all to devalue or you know, decenter the long standing, centuries long traditions of use in traditional capacities. But when we talk about traditional you know, traditional practices or legacy practitioners, that does include the black market. You know, I'm sure there are many people in this call who are involved in psychedelic medicine and in advocating for it because they've had really deeply impactful personal experiences, and those experiences all happen because of the black market, right? No one was illicitly producing this until very recently, and just speaking from the experience of for many years in a harm reduction capacity, I've worked closely with, like, part of my job has been creating relationships with people who sell drugs for the purpose of ensuring that the drug supply that is available to people remains you know, as unadulterated and reliable as possible, because especially with psilocybin, I can just say from having conversations with people who sell drugs for a living, psilocybin is not something people make very much money off of. And many of the people who are what you would call a drug dealer or someone who's, you know, on the corner selling psilocybin to people, those people are doing it for the exact same reason everyone is here, which is a commitment to the belief that this is something that people should have access to. And I guess, you know, elaborating on the point of making sure that the supply that people have, whether they're in a clinic or in their living room with their friend or their college roommate or something, is a safe thing. New Mexico does have access to and does have a actively growing program for adulterant screening for drugs. There's a Fourier transformed mass spectroscopy machine at New Mexico Harm Reduction Collaborative in Albuquerque. There's also one at the Mountain Center in Espanola, and there's one somewhere in Las Cruces. I'm not sure off the top of my head where, but we do have an existing free, you know, anonymous and pretty, you know, as accessible as anything could be, sort of program for developing actively in the state. At present, the ability to screen Thank you. At present, the ability to screen for organic substances is kind of obstructed just by the complications of having 1,900 different compounds in an organic sample versus hey, it's just a crystal molecule. But there's technology being actively developed also by companies in New Mexico for the ability to screen that sort of thing. So we've got a developing infrastructure for people who are utilizing this outside of formal capacity to ensure the safety of those substances. Thank you.
Thank you, Mason.
Hey, we've got one more, and I think that's about all we have time for. Paul, please unmute your line.
Hi, thanks for giving me the opportunity to speak a little bit more again. I just wanted to bring up one thing that really hasn't been discussed and talked about. I think I haven't heard it really in any other different programs either. And I think that the Department of Health could really benefit from having some kind of training program that addresses law enforcement and EMS and how to deal with not only psilocybin now that we're going to be doing this, and there possibly could be home settings and different things like that, but then also cannabis as well, and just having an education on how to address people, how to talk to people, and how to deal with people that are possibly having some kind of a bad experience versus a medical experience. And I think it would really benefit to have some kind of layout and some kind of education that would help with emergency care in these situations. Thank you.
Thank you, Paul. And at this point in time, we are just a couple of minutes from the end of our session. And so what I did want to go ahead and do is repeat the information we had said in the very beginning with regard to our program website. So our program information, the email is medical.psilocybin@doh.nm.gov. And our website is www.nmhealth.org/about/MCPP/MPP/. And both of those are on the screen right now. And then the other item I just wanted to let everyone know is we do have a method now for people to sign up for updates. And to do so, all individuals need to do is go to www.nmhealth.org. And from there, in the upper right-hand side of the screen, click on the sign up for e-news. Once you have done that, it will take you to a page which requests some information, essentially your email address, first and last name, and your physical address. Once you complete those, then just simply click on the Medical Psilocybin Program box, and that will sign you up for updates with regard to medical psilocybin. I should mention you are also welcome to sign up for any of the other categories that are listed on this page. You can sign up for multiple categories at the same time. You don't have to revisit the page each time. Once you actually have clicked on the categories that you're interested in, then just click sign up. And depending upon your system and your computer or your phone, you may then need to confirm that you are not a robot and then click continue. And so basically that is just how to sign up for updates. Once you have done that, you can then you will then receive updates for future meetings, additional meetings, and just general updates on the program as we release them. So at this time, I would like to thank you all for joining us tonight. We do not at this point have additional listening sessions scheduled because we are anticipating the board to be seated, the Medical Psilocybin Advisory Board, that is, to be seated later this month. And once it is, then we will set up additional listening sessions and/or public meetings with the board. In the meantime, thank you all very much. This concludes today's listening session. And thank you for participating and staying until the very end for those 33 additional people who did stay. Thank you very much. We appreciate you, and we appreciate the information, the feedback, the comments, and the concerns. I hope you all have a great and wonderful day, and we will see you all again soon, hopefully.